Hello, my name is Dr. Christopher Austin. I'm a UK-trained radiologist based in the rainy coffee capital and global tech hub of Seattle, Washington. I've been with Chiron for 2.5 years and currently serve as the Chief Medical Officer. MIA, which stands for Mammography Intelligent Assessment, is our breakthrough AI platform for breast screening. A suite of solutions, MIA is designed to empower radiologists and screening services to deliver confident, accurate, and timely results to any woman, anywhere. In this presentation, we will be focusing on MIA as an independent second reader, supporting radiologists in making the most important breast screening decision. Should a woman be called back for further testing or not? I'm excited to walk you through a demonstration of MIA's capabilities to analyze real screening mammograms from real patients. But before we jump into the cases, there are 3 things to point out. First, all of our cases come from women screened in double reader European programs. This means that 2 radiologists reviewed each mammogram, and a third arbitration reader is involved only when there is no consensus between the 2 readers. The cases are all 2D FFDM images produced from GE, Hologic, Siemens, and/or Giotto devices. The second point is all cases have been classified with ground truth evidence. Positive cases were truth with proven pathology results obtained from cytology, core biopsy, and/or surgical excision. And our negative cases were truth based on having no evidence of cancer during the screening interval or at the next screening round. Third, for each case, MIA provides the following outputs. For positive cases, MIA provides a case-wise and side-wise recall suggestion and an optional explanatory ROI or region of interest. For the negative cases, MIA provides a suggestion not to recall the patient. The demo includes 4 proven positive cases and 2 proven negatives. Each case is retrospectively analyzed by MIA and compared with the results of the historical readers and the ground truth evidence. Let's dive in, starting with MIA's analysis of the positive or malignant cases. This first case involves a mammogram of a 48-year-old woman. The images show prominent parenchyma and there is good positioning of the breasts. In the right upper lateral quadrant, there is a grouped area of microcalcification with a crushed stone appearance varying in size and shape. MIA's analysis recommends the woman be recalled and presents a case and sidewise suggestion based on the right CC and MLO views. An explanatory region of interest is also shown. Consensus on whether the appearances suggested malignancy was uncertain by the 2 radiologists, but both agreed to recall the woman. Based on the recall workup, a surgical specimen was obtained, proving intermediate grade ductal carcinoma in situ, or DCIS. This next case involves a 72-year-old woman. On inspection of the mammogram, there is an obvious mole in the medial upper quadrant on the right side. The breasts are symmetrical and fatty with minimal residual parenchyma. On the left, there is a small mass lesion with subtle adjacent microcalcifications. MIA's analysis of the images recommends the woman be recalled. An explanatory region of interest on the left is shown on the CC and MLO images, and the historical report showed 1 radiologist reporting the case as normal and not to recall the woman, while the other radiologist recommended recall. This went on to arbitration and a final decision was made to recall the woman. Core biopsy and subsequent surgical excision proved the presence of malignancy, confirming intermediate grade DCIS. Case number 3 involves a 47-year-old woman with dense breasts and heterogeneous parenchyma. There are lesions noted in the left breast, best visualized on the left CC view. One of these is stellate in shape. MIA's analysis of the images recommends the woman be recalled. And explanatory regions of interest associated with the lesion and microcalcifications are also noted on the left CC and MLO views. Both radiologists reported this case as abnormal and recommended recall, but were uncertain about malignancy. Biopsy and histology proved this case to be high-grade DCIS with invasive components. On to the next case. This is an unfortunate case of a 68-year-old woman whose initial scan was reported as normal, and she was not called back. The mammogram shows slightly dense breasts with heterogeneous parenchyma. Both radiologists reported the case as negative. On retrospective analysis of the same study by MIA, however, a recall suggestion is made based on the abnormal appearances on the right CC and MLO views. MIA also provides explanatory ROIs. Unfortunately, this woman re-presented before her next screening interval for a diagnostic workup. Surgical specimen confirmed invasive cancer, reclassifying this case as an interval cancer. Moving on to case 5, I'll show you how MIA performs on proven negative or non-malignant cases. This mammogram is from a 66-year-old woman. The images show dense, highly adenotic, heterogeneous breasts. Bilaterally, there are multiple small rounded opacities, but appearances are not overly suspicious. The two independent radiologists did not reach consensus, and the case went on to arbitration. The arbitration reader determined not to recall this woman. MIA's analysis also does not recommend to recall the case, in agreement with the arbitration reader. This case was proven to be negative based on evidence of no cancer detected during or at the next screening interval. This final case is of a 45-year-old woman with dense breasts. There are large rounded densities noted on the left side. Both radiologists agreed to recall the woman. MIA's analysis, however, does not recommend this case to be recalled. The case was proven to be negative based on evidence of no cancer detected during or at the next screening interval. And interestingly, had MIA's decision been available in this case, it would have avoided an unnecessary recall for this particular woman. Well, I've come to the end of the demo and hope that these 6 cases help illustrate MIA's depth of clinical rigor and technical know-how, all of which comes from training on more than 3 million images representing various demographic populations and mammography devices. I'd welcome the opportunity to meet with you and talk more about your particular breast screening service and MIA's capabilities. Do feel free to get in touch via the email address on your screen, and thanks so much for your time and your interest in MIA.